Okay.
Yes. Good evening, Esther. How are you today?
Good evening, Stella. I'm good. Thank you for
Glad
the invite.
you're most welcome. I'm glad to have you on this channel, and we hope to have a very productive session where we are going to see and cover in depth about food safety in relation to reproductive, maternal, young child, newborn, and adolescent health. So you're most welcome. Feel free to give us a snippet of what you have, and we will also come back with questions at the end of the session. So,
Thank
also
you.
to our viewers, you're most welcome. Feel free to engage with us in the chat box. Either you're watching from Facebook or YouTube, and we shall get back to you at the end of the session. So, thank you so much. I am Stella Kamami. I am a registered clinical dietitian, and our guest for today is Madam Esther Ateka. She is the she's an educationist at University of East Africa. Sorry, let me just mute. She's an educationist at the University of Eastern Africa, that is Baraton University, in the School of Nursing. So today, and maybe we can kickstart with an overview or an introduction about food safety. So maybe you can guide us through the main principles of food safety and some of the hazards in food and food safety outcomes.
Thank you very much, Stella. I'm delighted to be here. Thank you, Nutrition Association of Kenya, for the invite. We're going to have a great discussion regarding food safety and reproductive, maternal, newborn, child, and adolescent health. This is a very critical area in the area of nutrition. And as we all know, as nutritionists, reproductive health, child and adolescents, these cuts across because these are classified as the 5 vulnerable groups that we have. So food safety is very critical. Uh, because if we don't have food which is safe, we will not have a healthy nation. So to start briefly, before we look at the principles of nutrition, let's look at a brief statistics of food safety from the World Health Organization. Food safety, nutrition, and food security, they are linked together. There's no way we can separate the three about food safety, because if you're not food safe, your nutrition will be compromised and food security will be compromised. When we look at WHO statistics, we realize that we have an estimated of around 600 million, almost 1 in 10 people in the world fall ill after eating contaminated food. And that is very high number. Um, we're not doing well as a we're not doing well. Around 110 billion US dollars is lost each year in productivity and medical expenses, because you realize when you become sick because of food safety issues, you'll have foodborne illnesses, you will spend a lot of money in medical expenses. And nowadays, our economic is not doing well. Uh, NHIF costs have gone up, insurances have gone up, paying cash in hospitals have gone up. So sometimes we lose a lot of money treating this kind of illnesses. Children under 5 years, these are the critical ages, carry 40% of this food disease burden. And we are going to discuss and see how this is affecting future generation. According to someone called Karama 2023, he wrote something about nutrition and food safety. Access to safe food is key to allow individuals to benefit from its nutritional benefits. Because when we go out, when we go discussing about food safety, we have to really look at the benefits. What are we benefiting from all these other things? Back to your question, you had asked about principles of food safety. There are so many principles, and I'm not going to touch them per se one by one. It will come automatically when we'll be discussing in the session. Key principles, we have key principles we are supposed to follow matters food safety. Of course, we are supposed to eat safe food, cooked foods immediately when they are cooked. You are supposed to store food well. You are supposed to reheat. You are supposed to avoid contact with raw and cooked foods. So there are many. There are many cooking temperatures, contaminated equipment, utensils, and safe sources. Because we realize when we discuss food safety, it cuts across. We are not looking at food at the table. We are looking at food from the sources, right from the shamba when we are going to harvest, processing, preservation, up to when it comes to the table. So there's a lot in matters food safety. Um, we have few steps to food safety. We are going to handle that. The four principles that clean, separate, cook, and chill. I'm going to explain that later on, whereby by the time you're handling food, you're supposed to observe cleanliness at a uh, very high cleanliness. Separate, don't cross contaminate. Cook to proper temperatures and chill food which is supposed to be chilled. I think uh, for an overview, for a start, that's about food safety. Ensuring food is safe for human consumption.
Okay, Esther, that was a very good introduction. Thank you. You have briefed us on the main principles of food safety, and also you have emphasized the bit that it should start right from there. Food safety
Yes.
starts right from the farm to the fork.
Yeah.
So it is the whole process from the very beginning till we consume the food. So, can you tell us what are some of the common causes that cause food spoilage or food contamination, which in terms
Uh-huh.
leads to food poisoning?
Okay. Good question.
Yeah.
Thank you. So before we go to food spoilage, food contamination, uh, we have to look at what is really food spoilage, because for you to be sick, for this contamination to occur, something must happen in between. And food spoilage, as we all know, sometimes we buy food which is fresh from the market, sometimes you buy ready cooked food, but within no minutes, within a day, within few hours of cooking, like you cook food after 12 hours, it has gone bad. So food spoilage is any injury to food rendering it unsuitable for human consumption. And how is it unsuitable for human consumption? We have something called foodborne illness. This foodborne illness, it is caused by food going bad, food spoilage. And we have key things we have to look at. Key things why food go bad, we have number one, food contamination. Food can be contaminated, and I've said it can be contaminated from the source uh, right to the table when you are ready to eat that food. Food contamination is different from cross contamination. Food contamination is the presence of any harmful microorganism in food, which in turn spoils food. Because when you look at microorganisms, we have to look at those phases of bacteria growth. It has some phases, it grows, and then it spoils food. We have different types of food contamination, and this is very key to food spoilage when we are talking about food spoilage. We have microbiological, and this is very common, whereby we have different microorganism, and this one is worse to reproductive health, the mothers, pregnant mothers, lactating mothers, the young children we are talking about, and even to adolescents. So we have those microbial contamination. We have physical contamination. Physical contamination can be anything physical contaminating food. It can be hair. Sometimes as ladies, we go to kitchen, we are cooking without hair nets, hair falls off. Sometimes fingernails, you forget, you start biting your fingernails and it falls off to the food. Sometimes we have uh, glasses which are broken. You didn't have to see what is happening. We have chopping boards which are not fit for use in kitchen. We have things like dust, maybe in kitchen, those physical contamination, and they come accidentally to food and they contaminate the food. And lastly, we have chemical contamination, which it can happen accidentally or intentionally. Sometimes we add chemicals intentionally to food to preserve food, like when we use the food preservations chemicals, that is added intentionally. But accidentally, it is when chemicals, maybe you are mixing something and you overmix, you over dilute probably, or you put a lot of chemicals, that is accidental. Maybe someone didn't know the mixing procedure and the food becomes contaminated. Sometimes when you use chemicals in kitchen to clean surfaces, contact surfaces, in kitchen we have that contact surfaces for preparing food. So sometimes you mix chemicals and you overmix, or you put a lot of chemicals and you bring fresh food, you cut in the surfaces, it will contaminate food. So those chemical contaminations, it's either intentional or accidental to food. And that I think will be a topic for another day, because it's a whole food preservation and food additives. It's a whole thing in the market right now. And then lastly, we have cross contamination, whereby in the cross contamination, it comes as accidental transfer of contaminants. Sometimes when you're preparing food in kitchen, sometimes uh, us who are preparing, the workers, they have they don't have kitchenware, maybe they don't have gloves, they don't have lab coats, they don't have headgears. So sometimes these food handlers can contaminate um, through handling of food in kitchen or in food service when they're preparing food. And sometimes, you come to work when you are sick. So when you are sneezing, you are coughing, you are touching your hair, your clothing, that is cross contamination. And sometimes you are using broken things in kitchen to prepare food, uh, different types of food. That one is cross contamination. Sometimes you are using improper food storage. You buy food from markets, you have your fish, you have your meat, you place it in storage area in kitchen. You bring your bread, you place it on top. You bring your vegetables, you mix in the same area. That is cross contamination, because you cannot mix raw, cooked meat, whatever, dry stuff. You cannot mix them together. Sometimes you don't waste your disposal well. That is cross contamination. You have pests in the house. That one can hinder. It can contaminate food, and food will go bad, and definitely it will contaminate. When you are eating it, you will end up having foodborne illness. So I've said main causes you asked of this food spoilage that will lead to foodborne illness. We have food contamination, number one. We have time temperature abuse. Sometimes we cook, but you don't cook food to the required temperature. For example, when we talk about microorganisms, microorganisms will grow best in food which is favorable. Like protein food is very favorable to microorganism because it has the right qualities for microbial growth. Moisture is good, pH is good, all those things. So sometimes you cook, you don't cook to the right temperature, and microorganisms will probably start reproducing. uh, you cook food, yes, to the right temperature. For example, I can use when you go to celebrations, we go to weddings, we go to funerals, we go to birthday. Sometimes people cook at around 3 a.m. at night, and that food can stay up to 3 p.m. so that people can eat. That time is long enough for microorganisms to start growing. So sometimes time temperature matters a lot. How do you cook your food? How are you observing those temperatures? Sometimes you cook and you don't, because the rule is hot food is supposed to be served hot. Cold food is supposed to be served cold. So when you mix, sometimes you go serving and you get, it is a stew which is very cold. That phases of bacteria growth, it has grown until it is now peak of um, reproducing, and you eat those microorganisms, and at the end you end up having these foodborne illnesses. And then poor personal hygiene, definitely we've talked about that. And this cuts across the personal hygiene. It starts from an individual, your premises, uh, the equipments you are handling. That personal hygiene is very, very important. So those three things can cause food to spoil, and it can cause many, many things. And symptoms are many. It ranges from mild to bad. And the most common is nausea, vomiting, and diarrhea. To worst extent, yeah, you will find yourself later on having some disorders, and sometimes it can lead to death, especially in young children.
Okay, Esther, thank you so much for that informative and you relating it to the real life situation. It really helps with the understanding. So, with that knowledge on the principles and the hazards that come along with food safety, I think we can now go deep into how food safety practices can affect reproductive health, and also what are the risks that are associated with consuming contaminated food, especially for the pregnant women. So, with that knowledge, I think we can now go further in.
Okay, thank you. So, to reproductive health, especially maternal, pregnancy, and when we talk this reproductive, it is right, those preparing to get pregnant, pre-pregnancy, the pregnancy stage, lactation stage. Those stages are very, very critical. And if exposed to these food safety issues, it is a big, big, big problem. So, number one, we've said hygiene, we've said uh, um, what we've said hygiene, we've said those contamination, the cross contamination, and everything. For maternal health, we have to be very key, because if these mothers are not healthy, they'll not produce a healthy uh, baby at the end of the day. So, this reproductive health, we have these foodborne diseases that you are talking about, and they come in different. Some are short term, some are long term, especially when you have foodborne illness. That is, you can treat and you can go back home. But it becomes worse when you have foodborne intoxication. That one now is worse, because the microorganisms have already produced a toxin, and you consume the toxin. That is when you have the foodborne intoxication. And that one, if not treated quickly, it can lead to serious complications and even death later on. So these foodborne diseases may impact these reproductive health outcomes. Number one, we are talking about fetal development. This is for pregnant women. Uh, for these pregnant women, these hazards that we are talking about, the chemical, the physical, whatever, when they're not eating safe food, their fetus is not developing well. And at the end, it will affect the newborn baby. It can affect the development, the health of the fetus, and hence the newborn. We're going to look at those side effects. We have this common microorganism. There are two which are very, very common. The H. pylori is very common because of some complications. It affects perinatal outcomes a lot, and sometimes it can affect glucose metabolism and later on endothelial damage. We have also this one, the Vibrio cholera. It is a very, very common because of water, drinking contaminated water. We have water, we have access to water, but is the water safe for drinking? Sometimes we just assume like this is when you look at water, it is clean, you just take. It's very dangerous because you can have this microorganism, and sometimes it can affect a lot of electrolyte changes in the amniotic fluid, resulting from severe vomiting. So this hygiene issues is very key, especially to these reproductive uh, ages. We have another microorganism called toxoplasma. This one is very bad, and this can be transmitted during delivery vertically from mother to fetus, and it can have very negative, severe outcomes. Number one, it can range from this something we call fetal growth restriction. It can the fetus will not grow well, and by the time you are delivering, you'll have your preterm birth, and we all know the risks associated with preterm birth. Sometimes you can have fetal anomalies, and sometimes you can have congenital issues resulting to mental and growth retardation, and sometimes, if not well taken care of, it can lead to fetal death. So these microorganisms are very bad, especially during pregnancy. We have another very common microorganism called Listeria, something. It has a very high prevalence in severity during pregnancy. This sometimes can lead to fetal death. It can lead to preterm births and fetal distress. Just because we are consuming food which is not hygienic, drinking water which is not safe for drinking, it can lead to all these things. And sometimes it can affect, these diseases can also affect glucose metabolism, and uh, it can alter uh, the receptor's autoimmune response. There was a study, I was quoting it somewhere, maybe I'll share it at the end of the presentation, that some study was showing that uh, when you are exposed to high levels of nitrates, high exposure of nitrates when pregnant, although this was a study which was done in animals, but we all know studies done in animals correlate so well with human beings. So it confirmed that when a pregnant mother is exposed to high nitrate levels, it can inhibit iodine uptake when you are eating foods rich in iron, and this can lead to decreased thyroid hormone production. And later on, you'll have, of course, problems in pregnancy, and we don't want those MDDs, micronutrient deficiencies, during pregnancy. It will affect the mother and it will affect the baby at the same time. So in pregnancy, it is quite complicated. Let us seek medical advice as soon as possible. Let us observe hygiene at most, and let us eat food which is safe, because anything small will affect either the mother or the unborn fetus at the end of the day. Thank you.
Okay, Madam Esther, thank you for that. You have tackled it well on matters reproductive health together. I feel like you've also included the maternal health in it. So I would like to ask this: what are some of the ways that we can ensure safe food practices during pregnancy and lactation, especially for our moms, now that we have already brought forth life of these newborns?
For the maternal nutrition, food safety, number one is key. The key thing is hygiene. Definitely, we have to check on the hygiene of these mothers, right from the food they are taking, the water they are drinking, personal hygiene. We can concentrate on foodstuffs and you forget on your personal hygiene, because if you are not practicing cleanliness, definitely it will affect. Improved uh, This will lead to improved nutritional status of women of reproductive age. So this MCH, maternal nutrition, is very, very important. But the key thing in this stage is hygiene. Hygiene standards have to be very high, and seek medical advice where necessary, so that you don't like cross contaminate things you are using, the food you are taking, and such kind of things.
So, thank you. So, we have looked at the impact of food safety when it comes to reproductive health, impact of food safety in maternal health. Now, we can go to impact of food safety on newborn child. And so, what are some of the long-term effects that foodborne illnesses have on children's growth and development? And also, you can help us better understand how food safety impacts on the what is the influence that food safety has on the newborn child? Yes.
Okay, thank you. On the newborn and child health, food safety, first, we have to understand that good nutrition is key to the survival of young children. Survival, growth, and development. Because these are capped as especially the under five, they fall under the five vulnerable groups that we have, and children fall under that group. So if we practice good nutrition, we are going to help them survive, grow very well, and develop very well during their stages. Number one, how does food safety influence newborn? It influences so much in their growth patterns. When you realize when we do exclusive breastfeeding, uh, the child who is not exposed to these issues that we are talking about will grow very well, will breastfeed very well, transit to complementary feeding very well, and grow very well. But these children who are not exposed to these things will start problems with growth retardation, will start issues with appetite loss, will start issues with infections. That this is where we are talking about childhood infections. And this is where we go back to infection cycle, an infectious something cycle, whereby it will affect your immunity. Remember this food safety, if the child appetite is affected, this child growth is affected, this child malabsorption issues are there, weight loss is there, severity and duration of diseases, infections like diarrhea are there, this baby will be affected. And sometimes uh, school performance will be affected, and this is both a short term and long term effect. So that cycle, we are supposed to really, when we look at the food safety, there's something that we call uh, food food safety, sorry, let me find it, food system conceptual framework. When you look at that conceptual framework, it's talking about food supply, food environment, food and water. And sometimes these children are not exposed because of their vulnerability. So they are affected, and it will bring poor infant and growth issues. Now, another issue we have is poor infant and young child feeding practices. These children, we have policies for young child MYCN. So when food safety issues in young children, we realize because it is affecting their eating habits, it's affecting their growth, they start practicing poor infant and young child feeding practices. When you look at the policy, the MYCN policy, we have policy number 13, 16, and 17, which is talking about mixed feeding, which is talking about risks to those equipments that we use in feeding. Remember, sometimes, especially mothers, when you have firstborn, you have the only child, you want to buy all these bottles with teats and you feed. And you know those things, they have a lot of dirt when you are feeding in the teats. Uh, in turn, you're introducing infections to the baby, and in turn, diarrhea. So what are the risks associated with those feeding bottles, pacifiers, the teats? Because we believe when the baby is crying, give the pacifier. And sometimes, as mothers, you are working, you are not monitoring the child. At the end of the day, you say, I'm buying a lot of food in this house, I'm observing cleanliness, but when you are away, are you sure what is happening in the house? These young children who go to school, sometimes we keep cleanliness in the house, we give good water, we give safe food, but when they go to school, we are not following in school. So sometimes you pack, you know what we do? We pack with nice bottles, snacks, we pack water. But when they go to school, when water is depleted, where will they remove water? They go and use tap water. Sometimes those without tap water, they'll go to the river and fetch and they will drink. And sometimes that's how the cycle continues. Uh, how to introduce and prepare these safe foods? We have to follow the AFAS criteria. AFAS criteria, for those not in nutrition area, it means give these young children food which is acceptable. You don't have to force these children to eat like we've prepared githeri for supper, you have to eat. Give food which is acceptable to these young children. As long as it's nutritious, it is good, give food which is acceptable to the child. And if we go back to complementary feeding, introduce one food at a time. F for feasible, give food which is like reasonable. Don't bring something which is uh, not not feasible, like it's not suitable for this young child. You say, I want to start complementary feeding and I want to introduce your MENA to this 7-month-old baby. It's not practical, you know. uh, then affordable. Sometimes food safety, it has cost implications, and that's why when we started with what? Food safety, food security, and nutrition. If you are not food secure, meaning the cycle of food security, remember, income and everything, it will affect. So when you are telling someone eat well, as nutritionists we encourage people eat well, eat healthy, but have you really done background check to see if they are affording? Because you can tell me to drink milk daily, eat fish, eat liver, but is it affordable? So to these young children, newborn and children, because if you go back to newborn, they are doing exclusive breastfeeding. If the mother is not eating well, not be able to produce milk. If I'm not able to produce milk, African culture, they will say I've been bewitched, or someone didn't want me to breastfeed. Where I come from, you shall go, mothers don't breastfeed, they don't have milk, so even me, I don't have milk. They'll start giving you such funny excuses. And what will happen? The next thing, the baby will start feeding at a very young age. So all those things. So AFAS, acceptable, feasible, affordable, sustainable. The program you're introducing, it should be sustainable, so that, remember, we're talking about food safety. So when you are telling somebody keep this hygiene issue, cook like this, eat like this, is it sustainable? For how long are they going to follow that program? And safety, of course, we have to follow safety issues. One thing that I have to emphasize, uh, sometimes these children, they play outside. You can't like lock a child in the house for a whole day. Children will go and play outside. Down there, we're going to discuss on social, cultural aspects, how they affect food safety. When the children are playing outside, let's look at maybe low income areas or slum areas. We have this thing we call flying toilets. So shoop, it's gone. So when these children are playing, they'll get access to these feces, probably for humans, for animals. And then we have that thing called fecal oral transmission. And this induces some changes in the intestine. When they eat, the hands are dirty, they don't wash well. That is how contamination comes in. Sometimes when those feces dry in the estate, they become like sand. You are playing, sometimes wind comes that will go up and you inhale the same wind, and contamination, definitely. So fecal oral transmission is very, very common in young children, and it increases infections in young children. And when infections are high in young children, what will happen? They'll have lowered immunity. They will not eat well, appetite will be suppressed. They will have weight loss because they're not eating well. Growth pattern will be affected. And what will happen? Severity and duration of diseases. That is the cycle we are talking about. The infections will go on. The disease underlying issues are there. Probably the baby is HIV, the baby has cancer, diabetes. The diseases will go on and on and on, and then later on, inadequate diet because they don't want to eat. So the cycle goes, unless you identify the problem early, that will be better. To finalize on MCH, let me add on this. There's a study by someone called Mudoka 2010. He indicated that worse nutrition status among urban slums compared to rural areas, although household food security was a reverse issue. When we look at these findings, linking, there's another study, another book, I will share to Stella, maybe, linking nutrition to food safety. It suggests that an episode of diarrhea can lead to a potential pathogen-specific diversity loss in gut microbial communities. We all have these microbial guts So when you have these frequent episodes of diarrhea, it can lead to the loss of gut, the microbial, and this microbial whatever may contribute to malnourishment because you are not eating well. Reduced response to oral vaccines. You take the baby to the hospital, they are given vaccines, they are not responding. It's all about these issues. They'll have uh, I've talked about increased susceptibility to those infections like diarrhea and sometimes malabsorption. Of course, it is automatic. It will contribute to growth patterns that I said in these young children. So these several pathogens due to food safety issues, it impacts absorption of different nutrients. We have this thing called like helminths, the worms, I think. Yeah, they are the worms found in water. Those ones are bad. And in children, these ones can impact absorption of different nutrients. You are feeding very healthy. You say, I'm a nutritionist, you are eating healthy, but the baby has those worms. Uh, it's until you treat, uh, take to the hospital, treat, deworm, do everything so that the child can go back to nutritional status. So these infections has been attributed to so many other things like appetite loss and so many other things. So to young children, it is bad, and sometimes it has negative associations uh, to so many deficiencies like vitamin A deficiency, iron, and we have all those issues. And sometimes it can lead to many lower levels of issues in the body, leading to malabsorption issues. Thank you.
Okay, Madam Esther, thank you so much. So, having looked at the long term effects of the foodborne illnesses on our children, so how can food safety education be of benefit to the adolescents' nutrition and their overall health? Kindly tackle that.
Okay, thank you. Before I go to adolescents, I forgot the long term effects. There are many. And the worst is death. Mortality rates will go up. When I started with statistics, we saw children are the most affected. So, long term effects in children's growth and development, mortality rate is number one. And that's what you are trying to manage as health professionals. Let me not be biased with nutritionists. As health professionals, the doctors, nurses, nutritionists, and everybody, we are trying to reduce the rate of mortality rates. We have issues like chronic malnutrition, stunting. If not tackled early, these long term issues with children's growth pattern, it will lead to those chronic malnutrition, which is stunting. It can affect even cognitive, and there are studies. I have studies here relating to that. Cognitive development, it will affect, and that is correlated with school performance. And all these things we're talking about, it is correlated with foodborne illness. And lastly, it can affect even the social aspects of this child, especially with iron deficiency anemia. It will affect social. You'll find the child, if the appetite is not there, the child is very dull, don't want to play, don't want to associate with others. So it's a bad. We don't want to go there, especially long term effects. If we can do something, let us do something to prevent long term effects. So, you said about adolescents, how can food safety education benefit these adolescents? We have to educate about right food choices, and so that this can avoid eating disorders. Remember, adolescents are picky eaters. Not everyone eats. And when I started, I said we have those chemical contamination. When we are doing food preservation, we have. So when we do a lot of snacking, when you go to eating disorders, these things which are processed, definitely they have chemicals for preservation. Some are good, some are bad. I know if you take those bad chemicals, it will arise to these eating disorders. And so if we have education to teach and educate these adolescents about overall health, it will help. But before we reach adolescence, let's start with young children so that by the time they grow, they know these things. And When we do this, we will prevent these nutritional deficiencies, especially anemia, especially in girls, and obesity and mental health, because we've seen cognitive development from children. So it will really help a lot of issues. Adolescents can play, I think you asked also about what can they do in promoting food safety. Number one, they have to create awareness within their peer groups. You know, uh, let them engage themselves in adolescent groups, create awareness. They can look for friendly ways, especially engaging in social media with food safety messages. Adolescents are very good in social media, so they can, when they post their issues, we can encourage them also. We post a lot of food safety issues, and for those in schools, they can actively engage in clubs, do promotion regarding food safety, in communities, in schools, and everywhere. So, adolescent is a very critical age. You have to approach it carefully. And these are people who are experimental. They want to experiment with these issues. They can become sick, they will not say. So,
Hi, Madam Esther. Can you hear me? I think we lost you. Hello. Okay, let's give her a minute to try and check on her network, and then she'll be back shortly. Sorry, let me tackle a few questions on as we wait for Madam Esther. Lorna was asking, what do you mean by cold food should be eaten cold? It is that food that was hot but has become cold should be eaten cold. For example, beef stew that was hot, then I could not finish, so I kept it for the next mealtime. Shouldn't I warm it? Okay, I think Lorna, you missed a point on what she was trying to say. She was saying cold foods, foods that were meant to be eaten cold, should be eaten cold. For example, some of the foods that are eaten cold include salads. So if a salad was prepared and it was meant to be eaten cold, then that is the nature or the state in which you should have it. If it is stew, it was cooked and it was meant to be eaten hot, then that is the state at which you should have it when it is hot. So if it becomes cold, make sure you preheat it to the right temperatures and not just warm it. Make sure it heats well and even boils again so that the environment is not conducive for the microorganisms to thrive in. So I hope you have better understood that one. And then we can speak, I can talk a little bit about specialities. The Nutrition Association of Kenya offers different types of specialities annually, and we have so far 9 cohorts which have already finished. So feel free to join the specialities that are offered include pediatric specialty, critical care specialty, there's oncology specialty, and many more that are oncoming. So feel free to ask about that and inquire, and then we can give more guidance to that. Meanwhile, Madam Esther is back, and sorry for the blackout that has occurred to you, but we can continue. We were at the
Yeah.
adolescents and how they can be able to navigate on social media and the like. So, welcome back.
Thank you. Sorry, we had a short blackout. It's raining, but I'm back. You can ask the question again, Stella.
Sorry, I was muted. I was saying, let us continue with the presentation and then we shall tackle the questions at the end of
Okay.
the presentation.
Oh, okay. So I can go on and wind up.
Yes, yes, yes.
Okay. I, I was handling the adolescents, how they can create awareness within their groups, because this we have tried and we have worked closely with these adolescents. For them, they have to work closely with their peer groups. And when you're working matters food safety, because sometimes they're the ones, if you take statistics, especially in Kenya, you'll realize adolescents do a lot of work transporting food, processing, and all those things. We have to create awareness so that we promote food safety within themselves, within their communities. They have their clique. If you don't talk their language, they cannot understand you, and problems will go on generation and generation. Like malnutrition, if not tackled early, it can be a generational problem. It can go on and on and on. Because when we look like in UNICEF framework, we have from basic to immediate causes. And where does food safety fall? It falls under underlying causes when we talk about insufficient health services and unhealthy environment. Because these adolescents will be affected, they will not access health services. You go to health services, sometimes there's a time I went somewhere and it was a genuine question, and the healthcare provider was like asking, are you sure the way you are this big, the girl was bodied, so you could interpret obesity. So the healthcare provider was asking, the way you are this big, you don't know these issues, you don't know about hygiene, you don't know about eating well. Sometimes the way the approach we use matters a lot. If you don't use the right approach, adolescents will not adhere to these food safety issues. Uh, how do we ensure food safety at home? As I wind up and I handle policy, how do we ensure food safety at home? Hygiene, hygiene, and that one will keep on talking. Hygiene. Ensure especially your kitchen area is very clean. You have access to clean and safe water so that you don't have issues with cross contamination and everything. Uh, Hygiene in food preparation areas, the contact surfaces, for example, they should be clean. Once in a while, sanitize them. You don't have to buy sanitizers from the supermarket. You don't have to buy chemicals. The best is hot water. Just use hot water, salt, sanitize, and the preparation area will be neat and clean. Storage area should be uh, kind of separated. Don't mix dry stuff, wet stuff, cooked stuff. Let the storage area be clean, because if it's not hygienically clean, that is a good source of these things you are talking about. The microorganisms, those physical contamination, that is where you go, you find dirty clothes are there. Sometimes people are making their hair pieces there. Let the storage area be neat and separate items, and use the FIFO area so that you cannot leave things to. Sometimes we buy a lot of foodstuffs, like in hotels, you buy a lot of tomatoes, burgers, you leave it to go bad. So check, check so that you can use fast in, fast out. And cooking areas. So food preparation, be very keen. Uh, As a person, personal hygiene, keep it clean. If you have workers, if it is you in the house, keep it clean. Use the right gear from the head to the gloves to the lab coats. Hygiene should be observed. Environments where we are staying, ensure the toilets are clean. You have water, because to avoid those contamination, sewages and drainage, check on it. Clean water, check from the source. Where are you getting your water from? Um, if it is food, last time when we were having a NAC seminar with Professor was presenting, and someone was saying the client is avoiding to eat like apples because they don't know the source. I think they've stayed for a week and they're not going bad. So people are questioning the source. It's good to know the source. And if you're not sure, do your own kitchen garden farming so that you can consume healthy foods. How can policymakers, we have policymakers and health organization, those working in the health organization like hospitals, they can help us to reach out these messages. We have policies in place. Let's have coordination between the public and the private sector approach so that we can promote this food safety in these vulnerable groups, the reproductive age, the adolescents, the children, and have engagement with community health workers. It is very, very important. We have CHVs, we have community health workers, we have so many people. Let us engage with them because they are the ones who know the problems of the community. Let them inform us on what is happening. Let us have multidisciplinary approach because as nutritionists, as we are handling food, individual. What about the farmer who is farming those managu from the shamba? What about water department? What about public health? We don't have clean toilets, we have to link this food safety and nutrition. There's a report by Global Alliance for Improved Nutrition 2020. They did a literature review linking food safety and nutrition, and they realized that unsafe food creates a vicious cycle of disease and malnutrition, and this affects the big five: the children, the pregnant mothers, lactating mothers, adolescents, all those. It really affects this. And these threats to food safety, if you are not careful, it can occur at any stage of production, right from the shamba, right from cleaning, cooking, storage. You've stored your food for 1 week, you want to eat, it has gone bad, and then issues will begin. So it can occur at any stage, and it can range from contamination to those using chemical additives to unsafe handling to storage. So all those things mixed together, it can cause a lot of problems. To wind up, let us understand that we have food laws and regulations. We have, especially in Kenya, we have Article 43 of the Constitution of Kenya talking about food law, and it has protected it regulates production, trade, and handling of food. So let us be very careful the way we are handling food. Let us be like, if you are a business person, ensure that consumers' food is safe to eat and produced under unsanitary conditions. Don't jeopardize these issues, because there are so many policy issues that are handled at national level, down here where we are. And key thing we are supposed to emphasize is information, IEC, information, education, and communication. Very, very important. If we can have a strong framework right from national level, so that we can have like traceability. Good companies have these traceability issues. They can trace where the source, up to where you have sold it, who bought it, blah, blah. It will be very good. It will be very good. So there are a lot of policy issues, and at least the government is on toes on policy implication. to ensure that we have access to food, access to safe food at all times, especially to these vulnerable groups that we have talked talked about. We have several acts you can read about. We have acts like Food, Drugs, Chemical Substances Act. It talks about these food safety issues. Public Health Safety Act. It talks about Biosafety Act, Agriculture and Food Authority Act. There are so many acts. Water Act, which protects this. And these offenses, if you don't do the way it is punishable in Kenya under the Food Safety Act. Why is food hygiene important, as I wonder? Let us maintain those in industries and maintain the HACCP system for managing hazards. The hazard analysis and critical control points, very, very important. Number two, importance of food safety, access to sufficient amount of safe and nutritious food. Another one, unsafe food, if you are not careful, it will create a vicious cycle, the way we've seen. Disease, malnutrition, and these vulnerable groups are the ones which are affected. And this can affect our socio-economic development. Instead of going to work, you are busy taking care of patients at the hospital, you are paying a lot of money, you are supposed to have your free time, you are sick, you know, it can affect socioeconomic development a big, big deal. Sometimes cost of special dietary needs, nutritionists here can tell you, if they prescribe dietary is very expensive. You will start coughing in a lot of money, preparing things you are not used to. So special dietary needs, it has a lot of costs and sometimes to worst death. And we don't want to go there. So in conclusion, this there's a lot of linkages between nutrition and food safety, and to add food security. So this is linked in so many ways. It can be through direct association or indirect association. So let us really understand about these hazards. Let us understand uh, what impacts it has, and how can we what can we do as educated uh, people in the society to help uh, the the nation, so that we can increase so many other things. So key things: hygiene, hygiene, hygiene. Food from unsafe sources, avoid. Temperatures, cooking temperatures and everything, have a look at that. uh, Store food safely, store food, cooked food safely, cover it. If it's in the refrigerator, let it not stay more than 3 or 4 days. Microorganisms will start growing. By the time you eat, you are eating a contaminated food. Avoid contact between raw and cooked food, and let us avoid like assuming clean food. Don't mix the cooked and the raw. Don't eat undercooked food. That is where problems start. And as we are tackling the key people, maternal, newborn, child, and adolescent, this is a critical and vulnerable group that you are supposed to look at as nutritionists. Thank you very much, Stella.
Thank you so much, Madam Esther, for that conclusive study and presentation that you have made to us. There's a question from Carbon, and he's asking, will you talk about food preservation in regard to the vulnerable groups? So in this case, I don't know what he meant by vulnerable groups, but as for this presentation, our vulnerable groups, I tend to assume are the maternal, young child, and newborn, and also the adolescents. But the question was, will you talk about food preservation in regard to the vulnerable groups?
You are breaking. I didn't get the question very well.
Oh, sorry. Can you hear me now?
I request you repeat. You are breaking.
Can you hear me now?
No, it's
The
still
question
breaking.
is, Okay. Okay. Let me type the question to you. Food
Still
preservation in
Stella?
the vulnerable groups.
I've lost you.
Madam, I think there's a network issue from your end, but the question was, let's talk about food preservation in the vulnerable groups.
Talk about food safety
Food preservation,
or food preservation.
yes, in the vulnerable groups.
Okay. If I got you, you've said I talk about food preservation in vulnerable groups.
Yes, yes.
Okay. First, to clarify, I know most people, maybe not all are nutritionists. The vulnerable groups we are talking, these are the groups which are at risk uh, in the society. We're talking about young children, mostly under 5. We are talking about pregnant mothers. We are talking about breastfeeding mothers. We are talking about adolescents. And because today we want to discuss the maternal, newborn, child, and adolescents. To add on the vulnerable, we have the elderly, the shoshos, the gukas, and we have those whose immunity is compromised, those with chronic diseases, those fall under vulnerable groups. So this, when you're talking about preservation in this group, the maternal, newborn, child, and adolescent, especially young children, let me take example of complementary feeding. You've started feeding the baby, and remember this child or even the pregnant mother, whatever you are eating, it will have a direct impact to the unborn child. The complementary feeding you are doing, complementary feeding is introducing feeds to these young children of 6 months old and above. So when you are introducing, preservation takes a lot of dynamics. We have good preservation methods, right? We can take like yogurt. Yogurt is preserved. We use a good microorganism probiotic, which is very good in digestion. We don't have any issue, the baby can take. But you can imagine you're introducing food, you are giving processed food, you are giving like sodas, you are giving uh, juices in the market. These over processed foods, we're not saying like, but for young children, those chemicals that are used, sometimes they are of higher percentage. Sometimes you see in those processed food, they write the percentages, it is higher, and sometimes it can harm the development of the baby, especially the digestive system, uh, whatever, everything, the absorption issues, and it can impact directly. It can bar nutritional absorption of some nutrients, because like you start introducing those caffeine issues to these young children, by the time you are giving good nutrients, the iron, the vitamins, it will not be absorbed. It will have that contradiction, and the baby will be taking just, they are feeding well, but they are not growing. They come to the hospital, they'll tell you, I feed my baby very well, but again, you are overfeeding with these food preservatives, which are not fit for these young children, especially young children under 5. If we can, let us avoid the processed unless you're very sure what is preserved, what is used for preservation in that food. Most of these things, we can say they're not for you, for young children. They're not really recommended for young children. If you can avoid, the better. We can use raw natural food to give. And we have a variety. Visit any nutritionist. We have many nutritionists in Kenya, registered under Kenya Nutritionists. We have those ones who have been trained from NAC. Approach anyone. They can guide you very well on feeding, especially these children and pregnant and lactating mothers.
Okay, Madam Esther, thank you for that clarification and insight. We really appreciate you also for your time and sharing your knowledge and research with us. We really say thank you. So that marks the end of our presentation today on food safety in relation to RAMCA, that is reproductive, maternal, newborn, young child, and adolescent health. And we really appreciate you for joining us and watching us and also listening to us. So, till next time, I wish you all a lovely night. Thank you.
Thank you too. Thank you also for joining and thank you for listening. Thank you,
Anytime.
Nak.
Thank you. Bye.
Thank you. Bye.